For my first range of motion, I'm going to be performing elbow flexion. Elbow flexion occurs in the sagittal plane and has a normal range of motion of 145 degrees. So I'm going to have my partner go ahead and lay down supine. Other one on your back. Place this under your arm, so go ahead and lift up your arm. That's perfect. He's going to have his hand remain supinated, and he's going to bend his elbow up to 90 degrees. Okay. The axis of rotation will be on the lateral epicondyle of the humerus. And the stationary arm will be the midline of the humerus. The mobile arm will be aligned the radius. Go ahead and perform elbow flexion as far as you can. Okay. And he received 135 degrees. For my second range of motion, I'll be performing hip external rotation. Hip external rotation occurs in the frontal plane and has a normal range of motion of 45 degrees. I'm going to have my partner go ahead and sit down on the table. So the axis of rotation will be the anterior patella. So I'll place that just right here. The stationary arm will be perpendicular to the floor, and the mobile arm will be aligned with the anterior crest of the tibia. So go ahead and bring your leg in, just like that. Perfect. Okay. You got 35 degrees. For my final range of motion, I will be demonstrating cervical rotation. The action will be performed in the transverse plane, and the normal range of motion is 80 degrees. So I'm going to have you go ahead and sit down. So the axis of rotation will be the center of the skull. The stationary arm will be aligned with the acromion process. It'll be parallel to that. And the mobile arm will be aligned with the tip of the nose. So go ahead and rotate your head. Okay. He received 66 degrees, and normal range of motion was 80. All right, for my first manual muscle test, I'll be performing on the anterior deltoid. The origin of the anterior deltoid is the anterior lateral aspect of the clavicle, and it inserts onto the deltoid tuberosity. So I'm going to go ahead and have you lift up your arm to 90 degrees, and I'm going to stabilize his shoulder and his elbow, and I'm going to have him lift up, and I'll resist his action. Go ahead. Okay. Based on that, I'll give him a 5, and the action occurred in the sagittal plane and was flexion at the glenohumeral joint. My second manual muscle test is a TFL. The origin of the TFL is the iliac crest, and the insertion is the iliotibial tract. The actions are hip flexion, which occurs in the sagittal plane, and hip internal rotation, which occurs in the frontal plane. So I'm going to have my partner go ahead and lay on his side. His back leg will be bent to 45 degrees. Perfect. And his front leg will be right here. So I'm going to have him go ahead and lift this up just a little bit and bring it forward. And I'm going to stabilize right here and right here. So go ahead and lift your leg up and don't resist. Go ahead. Okay. Based on that, I'll give him a 5. My final manual muscle test is the rectus abdominis. The origin is the pubic crest, and the insertion is the excyphoid process. The action is trunk flexion, which occurs in the sagittal plane. So I'm going to have my partner go ahead and lay down on his back. He's going to have his legs fully extended, and his hands will be placed behind his head. There you go. I'm going to have him demonstrate a crunch, and he's going to lift his body up. Go ahead. Okay, because I can lift my hand under here and the inferior angle of the scapula is off the table, he receives a 5.